A very good morning to you all. We are all students of orthopedics, and as you must have heard till now that learning never ends, and we still continue to be students. And I definitely enjoy coming and listening to the lectures. Part of the trauma course was that last in the time was part of the general orthopedic first offline course we had, and it was a player listening to what Dr. Shailesh, Dr. Fahim, and now Dr. Vishal also. These are very committed teachers. They are teachers first. This happens to be a platform where they are sharing their knowledge. Their love is for teaching and sharing, and as I said, this is one knowledge, this is one wealth which increases by sharing. And even now, I definitely make it a point to try and listen to what the trauma people have to say. Although I have branched mainly into now arthroscopy, my most of the work is arthroscopy. But I was told when I was becoming a registrar, two things which are very important for you to understand. This is at a stage where people will teach you and tell you your mistakes. And once you become a consultant, you are their competitor. Nobody who is in a place of teaching will tell you your follies or will give you good suggestions. Till the time you remain a student, you remain student life over, but till the time you are a resident, you should make the best use of this time. And I was told by Professor Tuli that when I was starting my registrarship in Irvine Hospital, that these 3 years decide the rest of your next at least 30 to 50 years. People have been working. Dr. Tuli, I think, has worked almost 60 years. He was professor at 32 years of age, and now he's 90. So he has worked more than 65 years. So at least roughly whatever you will do in the next 3 to 5 years, that is till the time you finish your senior residency, will stay with you for the whole rest of your life. And believe me, that is what makes the difference. Even today I can observe it in my day-to-day practice. Learn good orthopedics, be a definite, this is the best forum. You must clear your doubt. Don't be afraid of making a mistake. Don't, at this stage of your life, making a mistake, you will get an answer to get the right direction. Once you are past this stage of residency, nobody is going to tell you that you have made a mistake or this is not the right way. Because then you have become a competitor to, or whatever it is. We have a very dedicated team of teachers who are teachers, and this happens to be the platform on which they are sharing it with you. I think make the best use, and whatever hard work has been put up is also visible in the quality of the book. I've just gone through it a little bit, but you can make out a lot of heart and soul has been put into by Dr. Shailesh, Dr. Fahim, and Dr. Vishal also. People like Dr. Shantaram Shetty and Dr. Ajit have been giving a good guidance to the trauma part of our conceptual orthopedics. I think what we look forward is your feedback, which is very important, especially negative feedback, which we can probably get better and better, and that is what is our aim. So we look forward, whatever you have issues which you want to be sorted out in a better way, and definitely keep going. And I can tell you that as head of the department in orthopedics at my institute, which is Gangaram, I do interview people. People are mentioning that they have done as part of their training the conceptual orthopedic. I am seeing it in the biodata which comes. I have seen 15 biodatas for the process of interviews whenever I am taking for registrar's post. They mention that they have attended the conceptual orthopedic training program. And that is what I think is a good sign that probably we are continuing to do some service to our fellow students. I was told by Dr. Dhal, he is my teacher also, he is 5 years senior to me, that we must train new people. He says, when we need orthopedic care, when we are old, if we have not trained, who will take care of us? So you must understand that there is a selfish motive also, which translates into giving good training, and I hope you continue to do the same way. And this is the thought process which is there in the group of teachers which you are meeting here, primarily to give you good guidance, become good clinicians, become well trained. If you are well trained, well qualified, you will always be in demand. You will always be, there is a shortage of people who are well trained and well qualified. Apart from it, in this platform, you might have seen there is no sponsorship which is taken by any of the companies or drug companies or pharmaceutical. No. It is purely going to be an academic, and you must maintain your ethics and right way to practice medicine throughout your career. That will give you a good dividend, and don't go just by whatever commerce driven industry tells you. Have good principles and follow the guidance which has been given to you. This will be, as far as your practical exam is concerned, your DNB exam, that's the first hurdle you have to clear. So this training will help you not only in the DNB exam, but probably more in whatever you are going to practice later on. And I hope you remain connected to the Conceptual Orthopedic family. I have suggested that we can have a Conceptual Connect program for people who have completed and still continue to get some guidance from the various faculties who are there here. Even if they have passed their exams, that is not the end. The whole practice of medicine is an exam every day. The question changes every day by the patient who is coming to you, and you have to be trained enough to deal with those questions. So that part will be probably going to take up as a Conceptual Connect program probably in times to come. I wish you all the best and make the best use, as I said, at this point of time, ask as many questions. Dr. Shailesh was particular that we must not have too many students and have as one-to-one interaction with the students coming and going and asking, and freely those questions so that those doubts are clarified. And that's what is the core of this course, is that you should take the maximum you can from here. I wish you all the best to you. Thank you very much.